Hello, lady. I'm
Hi.
I'm Ibrahim Dial. I'm the nurse practitioner. Welcome to the clinic again. Today we're gonna do musculoskeletal examination, but I wanted to please ask your permission to record the video.
Oh, yes.
You accept? Okay,
Yes.
great. Thank you for that. So today what we're gonna do is examining your musculoskeletal, from your hand, your wrist, your elbow, your shoulder, your neck, your spinal area, the hips, the knees, the ankles and the feet, right? So it's going to be a long process. We'll be changing positions back and forth, moving, the body here and there. So if you feel uncomfortable, please let me know so I can give you a break, okay?
Okay.
All right, so the musculoskeletal examination, we're going to start with the hands, right? um, First we're going to inspect the hands, for any type of swelling, redness, nodules, asymmetry. Let me see this one. For any type of redness, swelling, asymmetry, muscle atrophy, which I don't see anything. And then next, we're gonna proceed to palpation. The palpation here, we're gonna palpate the, you know, the, you know, the, the proximal phalangeal, then the distal phalangeals, the metacarpals, and we're gonna palpate all the digits for every hand. Let me see this one. We're gonna palpate this one as well. All the distal and proximal phalanges, the metacarpals, and I'm gonna ask you to, extend your fingers like this for both hands, like this. Raise them up as much as you can, and then down. Great, and then spread them together. That's abduction, and then together. That's adduction. So this was the flexion. Do it again. Flexion, extension, extension. Great. So now we're gonna move to the wrist area. The wrist also, we're gonna inspect the wrist for any type of swelling, nodules, asymmetry. Please put both hands for any nodules, asymmetry, muscle atrophy, redness or discoloration. And next, we're gonna proceed to palpating, the wrist. So what I'm going to do is I'm gonna palpate, the metacarpal phalanges around here. I'm gonna palpate the joints, and I do not feel, any pain. I mean, I do not feel any tenderness, any swelling. Do you feel any pain?
No.
Let me see the other one. Palpate this one as well. Palpate all the metacarpals and distal and the proximal phalanges as well. So next, what we're gonna do is we're gonna proceed to range of motion. So please go like this, and then make a fist. Great. Then keep your hands straight like this. Deviate to the left, both hand. This is like abduction, for radial deviation, and then not ulnar deviation, and then inside for radial deviation, and abduction, abduction, and no abduction and abduction. Do this one too. This is abduction, and this is adduction. All right. Um, So now, what I'm gonna do is to check if you have any problem with, tunnel carpal syndrome. So what I'm gonna do is I'm gonna overextend your arm right here, your hand, and I'm gonna tap onto the medial nerve. Do you feel any pain?
No.
So if there was like a carpal tunnel syndrome, the pain will radiate, from the index finger, the middle finger, and to the lateral part of the ring finger. So this one would be the same thing. So if I would hyperextend, type, the medial nerve right here, and if she would feel pain, it will radiate to the index finger middle finger, and then the lateral part of the ring finger. Fortunately, she does not have that. And then the other thing we're gonna do is we're gonna do the Fallen test. The Fallen test is just stand up, please. Try to keep your wrists together like this, and then try to touch them as for 40 to 60 seconds. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Do you feel any pain?
No.
All right, great. So she really does not feel any pain as far as like the Fallen test. Please have a seat. So we did the carpal tunnel test, and then we did the Fallen test. You know, both of them are actually negative. So now what we're gonna do is to inspect both elbows. Sorry. So as you can see here, I inspect both elbows, looking for any type of swelling, tenderness, or any type of deformity, or asymmetry. And then what I'm gonna do, I'll palpate, the occlusal area right here, and then I'm gonna palpate, the medial part of the olecrayon and the lateral part of the olecrayon. I do not feel any, tenderness. Do you feel any pain?
No.
There's no pain, no sensation. I'm gonna, also palpate the extensor, superficial ulnar part right here, and then I'm gonna ask you, for both. So I'm gonna check for both of them. This is the occlusal right here, and the olecrayon part on this side. I do not feel any tenderness, any pain. So basically, if there was like any abnormality, we would find like the golfers, the tennis ball players, they will have like a little ball like sticking out here, on this side or on this side. But for the baseball players, it will be like on this side, or it will be on this side. So now what I'm gonna ask you to do is flexion, extension, and then I'm gonna ask you to do pronation and supination. Do you feel any pain, any abnormality?
No.
All right, great. So that's actually great and simple. So now we're gonna proceed to the elbow. Regarding the elbow, we're going to, I'm just gonna raise this up a little bit, please, and then this one as well. As you can see here, both elbows, they look symmetric. I do not see any type of swelling, any type of inflammation, any type of asymmetry or muscle atrophy. So both of them are symmetric. They all like equal length, not one shoulder is higher than the other. So the next thing I'm gonna do is to palpate both sides. So what I'll do first, I'll palpate the bicep, bicipital groove right here, and then the tibial, the tubercle of the humerus over here, and then the subdeltoid, and then the anterior part, the posterior part, and then the anterior part. And then I'm gonna palpate the acrio subclavicular on this side. Do you feel any pain?
No.
So I'm gonna be doing the same thing on this side. I'll palpate the bicep. Please turn around a little bit. I'll palpate the the bicep process right here, and the subdeltoids, the tubercles right here, and and the REO subclavicular sites right here, and then I'll palpate the groove of the clavicle right here, the sternal. Everything is in midline. There's no swelling. There's no asymmetry. And then what I'm gonna do is to do a range of motion. So please stand up, facing this way. So for extension, extend your arm forward 90 degrees and all the way up, and then bring them all the way down. Do you feel any pain?
No.
Okay, then put your arm to the side. So this was a flexion and extension, and now we're gonna do abduction. So can you move your hands like this as high as you can? Great. And then put them back, and then do a cross. Make sure you can see her on the video. There you go, across. That's great. And then put the other arm. You can put this one back. Extend as much as you can. Do you feel any pain?
No.
Okay, great. So we did the palpation, we did the the extension of the shoulders, and then we did the abduction and the abduction. Now we're gonna do the special test. It's called the painful arc test. Right, the painful arc test is as she has her arms on the side. You're gonna try to move, extend both of your arm as high as you can. Do you feel any pain?
No.
So normally, if she would feel pain, that would have been positive for the painful arc test. But fortunately, it's negative, right? So the next thing we're gonna do is please have a seat. Now we're gonna inspect the neck. So I'll inspect the neck, for any type of deformity, for any abnormal positions, or for any type of asymmetry, or any type of deformities on the neck, which I do not see any. The next thing I'm gonna do is to actually palpate the neck. The palpation of the neck, we'll do like, I'll palpate the cervical area on this side right here to see if there's any deformities, and I'll palpate all around the neck, right? And then I will palpate the mandibular jaw, the temporal mandibular jaw. So I'm gonna put my fingers, next to the ears right here. Please open your mouth and close. I'll actually turn this side so the professor can see. Open your mouth, close, side to side. Great. So she's able to move the jaw. Did you feel any pain or any type of tenderness?
No.
Okay, and when I palpate, I do not feel any tenderness, or I do not hear any type of friction or click on that side. And so on the neck, what we're gonna do is we're gonna do flexion, extension. So touch your chin with your neck. That's great. Then look at the ceiling. Great. And turn to this side, and then to the other side. Great. So now look, try to touch your ear with your shoulder as much as you can. It's great. On this side, that's great. So as you can see here, she's able to flex, extend, look right, left, and then also try to touch her the shoulders with her ears, and there's no limitation to range of motion. That's like the lateral movement. Then the other thing I'm gonna do is you're gonna do like this. When I touch your mandible, you move your mouth side to side, and on the opposite side. Turn this way so the professor can see. Please open your mouth. Okay, left and right. Great. Make a bite. Make a bite. Bite. Great. So that was good. So the neck is actually fine. So what we're gonna do is we're gonna do the test. The special test is called the Sperling test. The Sperling test is if the patient was complaining about some type of neck pain, and what we will do is we tell her to you know um, lean lean to the side that's hurting her, and then what I'll do is I'll put a pressure against this side. I put the pressure and then push down, and if that would elicit any type of pain, that will indicate a positive sign for Sperling test, right? Fortunately, that did not. She does not have that problem. So now we're gonna proceed. Can you please lay down a little bit? Right now we are going to proceed to the feet, right, and to the toes. So first thing we're gonna do is we're gonna inspect the toes and the feet to see if there's any type of swelling, any redness, any discoloration, or any nodules, or any type of rash on the feet, which we don't. So the next thing we're gonna do is to palpate. So I'm gonna palpate the toes, right, the proximal phalanges and the distal phalanges, proximal distal, proximal distal phalanges, and proximal distal phalanges, right? And then I'm gonna ask her to, and I'm gonna palpate the metatarsal area on both sides. And then I'm gonna ask her to to dorsiflex, right, to put a range of motion. So can you please flex? Great. Extend. Great. As you can see, she's able to flex and extend at the same time. And then can you invert your foot? Can you invert your foot like this? Invert inside, and then this one, and then outvert. Great. So she's able to invert and also evert the feet, right? And the next step is we're gonna inspect the ankles on both sides. We're gonna be looking for edema. We're gonna be looking for swelling, tenderness, redness, discoloration, nodules, asymmetry, and or any type of deformities. And then the next thing is I am going to palpate the ankles area. I'm gonna palpate the lateral side and the medial side, to see if there's any type of swelling or tenderness or any pain, which I don't feel anything. Do you have any pain?
No, I don't.
All right. And then on this side, the same way, I'm gonna palpate the tibial area on the medial and on the lateral side, to see if there's any type of swelling or not. So now we're gonna proceed to range of motion. So I'm gonna ask you to flex, extend, flex, extend. Actually, when I was doing the feet, right, and the toes, I need you to move your toes up and then down, just the toes. Curve the toes. Great. And move them up. So that was the flexion and extension for the toes. Can you spread your toes? Can you try to spread them? Spread them like that. Okay. So she's able to spread them for abduction, and she's able to put them back together for adduction, right? So now coming back to the ankle area, as we inspected and palpated the ankles, and we did the range of motion for flexion, extension, and then can you move them to the side like that? Great. That's abduction. And then abduction, put it back to the initial position. Can you rotate your ankles? Okay, great. As you can see here, she does not have any, problem with the range of motions with the ankles as well. Now we're gonna move to the knees, right? And by the way, on the ankle side here, we have symmetry. There's no, abnormal or atrophic, you know, um, signs on the feet. Now we're gonna move to the knees. As far as the knees, now please put them to separate like that. So first thing, we're gonna inspect the knees for any type of swelling, for any type of redness, tenderness, fluid around the knees, inflammation, sign of infection, injuries, and so on. And as far as that, we don't see anything, like that. So now what we're gonna do is we're gonna palpate the knees. So I'm gonna palpate, this knee right here. I'm gonna palpate the suprapatellar, pouch, right, to see if there's any fluid accumulation. Then I'm gonna palpate the side of the patella, right, and then I'm gonna palpate this side as well, the patella, the suprapatellar pouch on the patella side, and then the humerus down here and the humerus on this side. And now what I'm gonna do is I'm gonna ask her to stand up so I can check the the other side, the popliteal fossa. Please turn around. So what I'll do is I'll check this side right here, palpate this side to see if there's any Baker's cyst around here, which I do not see anything. So now please lay it back down again. So for the knees, I'm gonna ask you to flex your knees, flex your knee, and flex your knee like that, and then extend. Great. And then flex your knee, and then extend. So as you can see here, she has a good flexion and extension for range of motions. And then she's able to lift the knees from 0 to 120 degrees or so. But now what we're gonna do is a very a special test here. One of them is called the valgus stress test. The valgus stress test is that please move this leg a little bit. So what I'm gonna do is I'm gonna touch the lateral part of the knee on this side, and then I'm gonna use my hand to touch the medial side of the lower foot, the lower ankles, and I'm gonna try to abduct this from away from the body. Okay, if you feel any pain, you let me know. Okay, you feel any pain?
No.
Okay. And then the other test that I'm gonna do is the the varus test. The varus test, I'm gonna do it on the opposite foot. So what I'll do is I'll hold my the inner part of the knee right here, and then I'm gonna put my hand on, this is the medial, I put my hand on the medial part of the knee, and then I'm gonna hold the outer side of the the ankle, and I'm gonna try to abduct, adduct like toward the body. If you feel any pain, you let me know. Okay, you feel any pain?
No.
All right, so that's negative for varus test. So here we did the valgus test and we did the varus test on each feet just for demonstration purposes. And then now the next test we're gonna do is called the Larchman test. The Larchman test, we're gonna, oh no, actually, wait, I'm gonna restart the valgus test. I'm gonna ask you to raise your leg to 20 degrees this way, right? And then I'm gonna put my hand to the lateral part of the left knee, and then I'm gonna put my hand to the inner part, to the middle part of the ankle, and I'm gonna try to abduct away from the body. Right? Do you feel any pain?
No.
Okay. Now for the varus test, I'm gonna do the same thing. Please raise your leg to 20 degrees, and I'm gonna put my arm to the middle part of the knee right here, and then I'm gonna put my hand to the opposite part of the ankle right here, and I'm gonna try to abduct toward the body. Do you feel any pain?
No.
All right. So that's it. So now the other test we're gonna do is called the enlargement test, right? And then I'm gonna ask you to raise your leg to 20 degrees, right? And then on the 20 degrees, one hand, like I will stabilize, the tibia area right here, and then I'll hold on to the popliteal side right here, and then I'll push and pull. Do you feel any pain?
No.
All right. And then I'll do the same thing on this side, 20 degrees, and then I got my hands under the behind the popliteal area. Then I stabilize the tibial area, and then I'll push and pull. Do you feel any pain?
No.
All right. So that is really the enlargement test. The other test we're gonna do is called the drawer test. The drawer test is like, I'm gonna ask you to raise your your knees to like close to 40, 60 degrees, and then I'm gonna literally kind of sit on your foot right here, and then I'm stabilize it, right? And then I'll, as the name indicate, the drawer's foot, what I'll do is I'll stabilize it. I'll push in, push toward me, that's anteriorly, and push back posteriorly, to see if there's any abnormality in pain. And then I'll do the same thing on this leg. The last test we're gonna do is called the McMurray test. The McMurray test is just I'll raise your legs right here to 20 degrees, right? And then I'll twist your legs in and extend it out. Do you feel any pain?
No.
All right, great. So we did the knees. Now the next thing we're gonna do is the hip area. Please stand up. The hip area, first I'm gonna please ask you to turn around. I'm gonna raise this up a little bit. Do you mind?
It's okay.
Thank you. So as you can see, like the hip area, what I'll do, please turn around a little bit. I'll inspect, the hip area to make sure that there is a symmetry on the hip area, and then not one side is not bigger than the other side, right? And then I'll try to, palpate the I'll try to palpate the posterior superior iliac spine right here, and then I'll palpate the anterior, turn around please, and then I'll palpate the anterior superior iliac spine. Both side is in symmetrical positions, right? And then after that, I'm gonna ask you to please turn around again. I'm gonna ask you to like bend forward to 45 degrees. Go as far as you can.
Okay.
Right. So here I can see that the anterior, the posterior superior iliac spine, is in is in alignment, with both sides. So there's a symmetry here, and then I see that she's able to flex, right? And then stand up. But actually, for the range of movement, I'm gonna ask her to lay back down so we can reperform the range of motion. So for the range of motion, I'm gonna ask you to flex your knee to 45 degrees. 45 degrees. Lift it up.